What's up? Sorry, I was trying to get a look at my uvula, a little hangy ball thingy in the back. All right, well, this is muscles from Holes, Anatomy and Physiology, and we're talking about muscle anatomy specifically and naming. Now, some of you might be asking, first off, why is it important that I know the names of the muscles and the muscle conventions for how we name things? Well, when you get older and you are ripped physically like me, it'll be important for you to understand the names of all your different muscles so that when you are filming a commercial for your body and the director says flex pec major, like you'll see in the video that I created, you'll know which muscle to flex. So let's show you the video that I created here for you. Yes, I shaved my head for this one. Wait for the flame sacks. Here it comes! Danger! Check out my back muscles right now. Look at that. Rocking it. That's the power of muscles, not music. That's the power of muscles. All right, so let's talk about how we're going to name all these things so that when you're filming your commercial like I just did, you'll know what you're talking about. First of all, the naming conventions and all the groups of muscles. We have a prime mover, which is also called the agonist, and this is the one that is responsible for the major movement. So if I'm moving my radius and ulna, sorry, not my tibia, my radius and ulna, my biceps is the prime mover, the agonist, and the antagonist would be the triceps group, because it opposes the action. So if I were to flex my triceps at the same time as my biceps, then I wouldn't be able to move my arm at all. It wouldn't go either direction. If I flex my triceps, my arm moves this way. This would be the antagonist. If I flex my bicep and shorten it, this is the agonist, this is the antagonist. The synergist is all the other muscles that aid in the movement and prevent rotation. So for example, when I'm doing this, a synergist would be my deltoid muscles, because and my pec major, helping to hold up my arm, preventing rotation, fine. And then the fixator stabilizes the origin of a prime mover, meaning helps to maintain the attachment point for the prime mover. How do we name them? So we'll give you a few examples, and then we'll go through all the different body parts and things that you got to know. So they're named based on their directions. So you may see muscles called rectus, such as rectus abdominis. These are straight muscles. Rectus means straight, sometimes based on the size. Maximus, like gluteus maximus, that would be your butt muscle. There's also gluteus medius, and there's gluteus minimus. Not often discussed because they don't give you the badunkadunk that you really want. Sometimes for location, so temporalis is the muscle that lays over your temporal bone, or occipitalis is over your occipital bone. Number of origins, basically kind of attachments to the bone there. You have 3, for example, in the triceps. There's 3 parts to the muscle, to the group we call triceps. Sometimes the location of the muscle's origin and insertion. We'll talk about origin and insertion later. But an example would be sternos, such as in the sternocleidomastoid. Sterno is where it's the origin of the muscle, and the insertion, and it's attached. So you have the clavicle and the sternum, and then up to the mandible, the jaw. Shape of the muscle. Deltoid is triangular. I know that because when I was a freshman in college, I was a hasher, which is a fancy way to say busboy dishwasher, at Delta 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 at UCLA. Delta, delta, delta. I did that for a couple months and then realized that I wasn't getting to meet any of the girls. I was in the kitchen washing dishes. Not a good job. And then also by the action of the muscle, what it does. So flexor, extensor. We did that exercise in class today. All right, let's go through specifics, the muscles that you have to know. Now, there's a few things pointed out on these slides that are not muscles, such as you'll see here, this cranial aponeuroses. To give you an idea, aponeuroses are sheet-like tendons. Instead of a ribbon that's a tendon, it's a sheet-like tendon. Those are called aponeuroses. All these muscles named here, you got to know. Muscles in the neck, muscles in the skull, and also in the face. Okay? You can spend your own time going through that more specifically. Muscles of the trunk. This is what my abs look like because I have an 8-pack you saw in the video there where I shaved my head. Here's my chest, my pec major, deltoid. Here's the clavicle running across. You see biceps, then brachialis hiding underneath. You can kind of feel brachialis if you flex and you feel a little tendon in there right inside the where you can see where I'm holding it up, the tendon right there. Just to the sides of that are going to be your brachialis. It gets really skinny right there. And then you have all the abdominal muscles that we mentioned, obliques. You can see the oblique refers to the direction. You can see the angle. Here's internal obliques. Here you have external obliques, transverse abdominis, just like the, transverse goes across, like the plane that we did before. Deep trunk and arm muscles. Here we have the erector spinae that run up the spine of your back. These feel really good when they get massaged. Feel free to have someone massage you right now while you're watching this video. It'll be far more enjoyable. Here's the other muscles of the back. The trapezius, latissimus dorsi that you see here. These are the ones when you see a bodybuilder, they have wings that stick out almost because their lats, their latissimus dorsi, are so big. And that's for male or females. Go. Oh, it looks like we're freezing up here. Then we get some muscles of the pelvis, hip, and thigh. One to point out is the iliopsoas. We're going to work with the psoas muscle right here, which is attaches to the inside of your hip, inside of your coxal bone. When we do our rabbit muscle lab, and we look at how muscles contract, we actually use the psoas muscle from a rabbit. Why the psoas muscle, I have absolutely no clue. The leg can get pretty complicated. You'll see all these in the quadriceps group. Rectus femoris, the fibers are straight. Vastus lateralis, and then vastus medialis, you can see. Those are all the quadriceps group when we say quadriceps. Then you have sartorius, very characteristic, all the way down around the knee. Excuse me. And then the adductor group, that's the one that helps you to add your leg to the other one for the adduction motion. All right, so there's more muscles you got to know there. Muscles of the lower leg, you have the gastroc, also called the calf. It's this double muscle. If you have very strong calves like I do, you can actually see the distinction between those two muscles. Soleus hides under here beneath your Achilles tendon. And then you also see on the front side you have the various, let's call them shin muscles that cause shin splints. Shin splints are when the muscles start pulling away from the bone because they're attached all along the length of the tibia here. Here you see the soleus wrapping around there again. But fibularis brevis, tibialis anterior is the main one that comes detached from the tibia or starts to pull away from it, and you start to feel that. Those are shin splints. And then getting to finish here, we have just the overall body that you'll do in your project, all the different muscles. You see how complex the legs are, in fact, the upper leg, and the deep tissue, the deep muscles of the chest and abs and so on. And then we have the posterior view of the muscles. And then on that note, we are done. On to bigger and brighter things.